We want to bring in our guest. Joining us now is Batya Ungar-Sargon, a columnist at the Free Press, a frequent contributor to Fox News, Newsnation, and Sky News. Her work has been published in the Washington Post, the Los Angeles Times, and New York Times. And Batya is the author of Second Class: How the Elites Betrayed America's Working Men and Women. She's been a vocal supporter of President Trump and the MAGA platform. And she's also worked with one of our favorite partners, Braver Angels, which brings folks who are Republicans and Democrats and people of all ideological stripes together to engage in civil and meaningful dialogue aimed at depolarization. We want to welcome Batya to Why Should I Trust
Yay.
You?
Welcome.
Thank you so
Welcome.
much for having
Welcome,
me. I'm a little
welcome, welcome.
intimidated by the credentials at play here, but I'm totally honored to be here. And I really do hope you'll ask me anything you want to know. I'm sure you guys have a lot of people who like really, really, really support what President Trump is doing. I really, really, really support it, and I'm really, really so grateful anytime I have the opportunity to talk to people who don't about that, who might be open to hearing how somebody sees things a little bit differently. So all of which is to say thank you so much for having me. It's an
You're so
honor to be here
welcome.
and an honor to be in this conversation with you and your
And we
audience.
want to do a shout out for your book, Second Class. I think it's in the background there too,
Yes,
but
yes.
for everybody who's listening, Second Class: How the Elites Betrayed America's Working Men and Women. And that was quite a project with you traveling the country, talking to the working class and finding a lot of interesting things. So you're kind of the perfect person for us to talk to help us kind of navigate, what's going down here. Because we do talk to a lot of MAGA supporters. We talk to a lot of MAHA people
Mhm.
who took a leap of faith in voting for Trump, kind of like their first foray out of the Democratic Party. And so your help here is, I think, going to be great. I'll just kick it off with one first kind of question. I heard you mentioning just a great piece, and we all kind of kicked it around here. And this was in the Free Press. And it was written by Evan Barker, and it was titled "When Maha Forgets the Working Class." And she was a longtime Democratic fundraiser, worker, volunteer. And this past fall, she voted for Trump because she says a policy, but also there's a culture of attitudes and a fundamental like lack of understanding by elites of the about the working class in this country. In her piece, she writes, "Some of Maha champions remind me of the people who pushed me away from the modern Democratic Party by refusing to acknowledge the daily struggles of ordinary Americans." So she's saying some of the folks championing Maha, Make America Healthy Again, don't get the struggles of the working class. Can you help us like unpack that? What are you hearing in that?
Yeah, absolutely. I think a fundamental reason Donald Trump won was dignity, dignity for working class people. In many, many, many ways, they had felt um, and really were actually had their opportunities to pursue the American dream radically reduced over the last 50 years. And increasingly, when they would speak up and complain about it, elites in the Democratic Party or liberals or leftists would sneer at them or smear them. There are many examples of this. The reason I bring this up is because something that I think is unbelievably important for both Republicans and Democrats to understand right now is that Donald Trump won because he flipped a lot of people who were Democrats 2 years ago, 5 years ago, 10 years ago, and 40 years ago. Those people voted for him because they saw in him not an extremist, but a moderate, indeed a throwback to the Democratic Party in its 90s era version or even in the New Deal version. And we can talk about that if you guys want. But those people are gettable for either party. Either party that wakes up and says, we're going to treat you with dignity and respect, those people are gettable. And it's so simple. There's so much panic happening right now in the Democratic Party. How do we, get back? How do we win? What messaging should we? It's very, very simple. Listen to your voters. Love the American people. They are very worthy of your love and respect. Allow them to tell you what they want. That's actually what Donald Trump did. He started going to CPAC and listened to which lines got the most applause. And instead of saying these people are deplorables, he said maybe there's something here. Maybe the American people deserve leadership that responds to what they want. So let's talk about Evan's piece. Evan Barker is a remarkable woman. She has a chronic illness and has overcome so much. She raised about $50 million for the Democrats and finally just couldn't take the elitism anymore of the party and, wrote her big swan song, exiting the party. She, from the DNC, actually, she wrote it for me at Newsweek. And she was writing this piece because she started to see the same kind of elitism infecting the MAHA discourse. Now, I don't think the whole MAHA movement is elitist. The opposite. Obviously, poor people, working class people bear the brunt of everything bad gets much, much worse as you go downstream. My father's a neurologist and he talks about this all the time. He can have two patients come in with the exact same x-rays. And one of them is working class and was sexually abused as a child, and the other is upper middle class and grew up in a very happy family. The working class abuse survivor will have unbelievable chronic pain with the same x-ray as an upper middle class person who can afford massages and therapies and whatnot, who will barely feel it. So much of this is connected, and the downstreaming of all of the crap in our cheap food and all of the crap in, our whatever medications and so forth, of course, that is borne disproportionately by the working class. But a lot of the kind of crunchy, organic, conspiracy-oriented solutions are very geared towards people with time on their hands.
Batya, when you and I chatted, you had a really interesting take on Robert F. Kennedy. And I want to ask you about him because I think you have some concerns about whether he really is the right guy to kind of for the working class, for MAGA supporters.
Yeah, I want to start by saying what Donald Trump did by bringing RFK Jr. into his cabinet, the same thing he did bringing Tulsi Gabbard into his cabinet or Lori Chavez DeRemer. Like, this is the most ideologically diverse American cabinet possibly ever. These people are all, Lori DeRemer is a conservative, but RFK Jr. and Tulsi Gabbard are liberals. They're not conservatives and they're not Republicans. That is a very cool thing to do. And I think Donald Trump was trying to signal to the electorate, I'm going to be the president for everybody. And I truly admire that. And as somebody who identifies as a leftist populist, like a leftist who supports MAGA, that was for me, right? That was for me. But
I think though that a lot of that, the appointees like that, it's not the variation in ideology that gives a lot of people concern. It's for example, qualifications, right? So like, what are the qualifications that RFK Jr. may have to do this job?
Right. So we could spend a lot of time about, I personally think that the qualified class got us into a lot of the messes that we're now trying to claw our way out of. And so I think that was actually a big plus for a lot of people who voted for Donald Trump, certainly was for me. But when it comes to RFK Jr. specifically, I really wish he had gone in a different direction. And the reason for that is because this is a person who started out life with unbelievable privilege, limitless privilege, money, the name recognition. He could have done anything with that platform. And what he chose to do with it was to dupe poor people effectively. And I have a real problem with that, and I think that it infects the way that he sees things. Poor people are unhealthy because they're poor. Working class people are overweight because they do not have time to eat healthy and exercise because they're working 3 jobs to feed their kids. And because RFK Jr. does not know anyone like that, because he lives in this rich bubble, he effectively only knows people who have rich people problems. And, those problems are real. His phrase that he has, healthy people have 1,000 dreams, sick people only have one. It's so true. And of course, I'm sure we all in the privileged cast know people who suffer from chronic illness or from problems and are upper middle class. And my heart goes out to them. Seriously, it's sad. But there are actual, real, deep-seated systemic problems that are infecting millions and millions of Americans, and they are not autism that they got from a vaccine. And he is hoodwinking people whose lives are already unbearably difficult. I mean, can you imagine being poor or working class and having a child with extreme autism and being a single mom and having to feed that kid and keep a roof over their head? And maybe you have three other kids who you have to feed and get to school and give a normal life to. And you have a very autistic child who's sometimes violent, who's non. Can you imagine how difficult that person's life is? And here you have a rich millionaire with the name Kennedy coming along and saying, "Oh, someone did this to you that because you took the vaccine." It's disgusting. It's
You
disgusting.
called it class
really,
warfare too. I mean, and
Yeah.
that I heard you say that, which is really
Absolutely.
interesting term. Sorry, Maggie, go ahead.
Oh, no, I was just going to say I really appreciated your passion on this topic because I think it's something that often gets obfuscated, right? So autism is a serious condition that children suffer, and ultimately by diverting our attention to something that's been debunked, we're not giving solutions to people. We're not putting forward the research to help with new therapeutic interventions. And I wonder if you might talk about how you see the role of healthcare in this intersection of MAHA, MAGA, moving forward to like break down this class barrier, because healthcare ends
Absolutely.
up being one of those the biggest hurdles.
So when I was reporting my book, Second Class, I was flying around the country. I interviewed hundreds of people, working class people, meaning people who don't have a college degree, don't work in an industry that requires a college degree, work with their hands, and who are locked out of the American dream, the top 20%. Actually, some are not locked out of the American dream. Actually, very hard to admit, red America, you're much more likely to become a homeowner if you're working class just because of the price of housing. You know, it's something that we don't like to talk about from blue states and cities. Um, there was unbelievable consensus among the people I interviewed, and this was regardless of whether they were progressive or MAGA, whether they voted Democrat or Republican. They, almost every single person had very similar worldview, very similar policy choices, preferences, what they would like. The top two policy issues that I heard, and this is regardless of whether somebody was a liberal or conservative, was we want much less immigration and much more access to healthcare. And when I was promoting the book, I was saying the first party that gets to that combination is going to have a ruling majority for 40 years. And I thought in my naivete when I was writing the book, like obviously Democrats are going to be receptive to this because this was their platform. I mean, as recently as 2015, Bernie Sanders was saying, open borders, that's a Koch brothers proposal.
Nice impression, Batya.
Thank you. It's my only
Yeah.
impression, so I have to whip it out whenever I can. You know,
But wait, you
like,
said that they want more access to healthcare, but at the same time, right now we're giving a message or hearing a message that the healthcare system is so lousy. It's burdened us with just an enormous amount of chronic disease, and it's not working. So what is it? Is it you want more access to healthcare, or do you want a different healthcare system and let's start over?
I think, these are people who are very busy working. Like they don't have like the time to sit there. They know that they feel that they can't afford high quality healthcare. They know that everyone in their community is unhealthy. They know that they are obese and they can't do anything about it. And they don't have the time and the energy and they know that their kids have ADHD and are diagnosed with a million things. And they have three kids and one of them is making it impossible for the other two. So, honestly, I think if Trump had come up with Medicare for all, like they would have supported that. MAGA would have supported that. And so to me, there's a sort of like a bittersweet thing to the MAHA thing. Like Trump has a genius for understanding what the American electorate wants. And I think he did understand that people feel really plagued by healthcare issues. They feel really ignored. They feel like we're the richest country on earth. How is it that I can't afford high quality healthcare? How is it that these people are going bankrupt over healthcare? But I think that what he did was he slotted in RFK Jr. into that spot. And I understand why he did it. I'd rather he did that than nothing, but I just hope that this is not instead of, because we do have massive problems. But I mean, if you listen to how Trump talks now about insurance companies, pharmaceutical companies, he sounds like a leftist. When he talks about war, he sounds like a leftist. When he talks about immigration and tariffs, he sounds like a New Deal Democrat. So we're used to thinking because the media has portrayed him as a far right extremist. But if you look at the actual policy and try to hear him the way that his followers hear him, he sounds like a person of the left. And I think that there is reason to hope that he will be in charge. I think in a lot of these relationships with, people who, I'm not a fan of Elon Musk. I think at the end of the day, Trump is going to rein them in because he has a very clear idea of what the mandate is.
Let me ask you something about the idea of MAHA and some of the platform coming from a more privileged, and RFK Jr.'s voice coming from a more privileged space. I mean, when I say that to some of the MAHA people that I've been in touch with, they kind of think that's a cop-out because it's like the idea that you can't kind of take on big things and solve something systemically and do preventative medicine because nobody has the time and people are too poor. That like, how do you get big things achieved? That we're a country of innovation and that should invest to solve big problems. What do you say to that?
So first of all, I think he can do amazing things. Right now, preventative care is not covered by the government, is my understanding. Like there are no medical codes to cover preventative health interventions. I mean, I know my mammogram every year
maybe
is
it like
covered.
depends, right, Mark?
It depends on your healthcare insurance for sure.
But my understanding, I mean, I was talking to somebody about this at CPAC, so, take it with a grain of salt, but he's a doctor and he was explaining to me that a lot of that is not covered by Medicare. So meaning there's no codes for things that would make us much healthier if we did them in a preventative way. There's no reason that a rich person like RFK Jr. with the Kennedy name should not be able to say, starting tomorrow, we're creating codes to reimburse for preventative healthcare. Like that would be a genius thing he could do immediately. I hope he does do that. If you're listening, RFK Jr., like, please forgive me for everything I said. Just go do this. There's a lot of.
Please don't give us more codes. I mean, there are so many codes. I mean, the system is so complex. I mean, that's like a whole other thing. But Medicare does cover preventative services like screenings, exam, lab tests, things like that. I mean,
that was one of the big accomplishments of Obamacare was preventative care.
I don't think
right.
When we say preventative care in the MAHA way, I think what they're talking about is like, regular meetings with a dietitian.
Yeah.
A gym membership and we have a ton of people who want to be successful entrepreneurs who want to be, personal coaches. Like, why is there, we could easily say, hey, we're going to get a government subsidy for that, right? Like ways of intervening in people's lives to just make them healthier, not to prevent them from or to screen them for cancer.
Mm-hmm.
But to actually
do
what we all do, what upper middle class people all pay for, which is like, Whole Foods, like going to the gym, like.
Yeah, so that idea ends up, to me, comes across as more government intervention when the entire platform so far has been less. And a lot of the policies like cutting Medicaid, cutting backs, all of these different integral programs seem to be doing the opposite.
Right. So Donald Trump is definitely not going to cut Medicare. He's promised that many, many times. It's not on the table at all. And, luckily RFK Jr. is a liberal. So he's, it doesn't seem like the kind of person who'd be like invested in that. He's not some guy who's like a deficit hawk. Trump is not a deficit hawk. He doesn't think the deficit is real. He doesn't think the debt ceiling is real. So I'm not very worried about that. I know Elon Musk is doing a big performative thing of firing government workers. These are desk jobs, right? That's not to say that we shouldn't be investing in other things.
I don't mean to interject. It's just I think that it's important to note that they're not just desk jobs. These are people who were serving the American people for a long time. And many of them were friends and colleagues that were let go for performance issues that weren't real. And so that is.
I think you'll have me back in 2 months and you can ask me about this. I think a lot of those people will be restored. I think what we're seeing right now is a very aggressive audit. And I think it's clear already, like, Marco Rubio was trying to get, he gave the green light and the White House gave the green light for certain AIDS treatments to be shipped to, or the aid for AIDS treatments to be shipped to Africa. And then 2 19-year-olds on Elon's team just basically axed the payment. Like, that's not going to stand. Yep. That's not a long-term situation. I think Trump is waiting for Elon to get sick of this and move on. But the idea that there aren't things that are worth investing in is not a contradiction with the idea that we're paying a lot of things for a lot of things that are not worthy of being invested in.
Right.
Trump has
I think there's a little confusion about, cutting Medicare versus Medicaid. And, back to this idea, nobody's really talking about cutting Medicare. I mean, I think it's really about cutting Medicaid, right? So these people that presumably many of you whom you met when you were out on your tour, working class, who don't have high incomes, many of those probably qualify for Medicaid. And the idea
Actually,
is
they
that these,
don't. So there's a gap. The problem is the poor in this country actually you can get if you do not work, you can get up to $45,000 a year in benefits. So there's a thing called the benefits cliff, where let's say
right.
you have a woman, right, and she's a great worker. She shows up on time, which is very hard these days. She's a great worker, takes it seriously. She's working 35 hours a week, and her boss says to her, hey, you're a great worker. Let's get you on full time. I'll get you some benefits. Like, you know, this will be great. You'll be on salary. You'll make more
Yeah,
money. If she takes a $2 an hour raise, she can
right.
lose up to $45,000 in benefits. And the worst part of it is on the healthcare front. So she would be on Medicaid on 35 hours a week. The
Right.
minute she goes up to 40, she loses it. And let's say she has a disabled child. She cannot know ahead of time if the new insurance will cover the things her child needs. It's like the dumbest thing in the world. Everything is set up to to penalize good behavior and to penalize strengths. People want to work. They want to work, but the
Yeah, I think
whole
you're talking
system is
about the
set up to.
ideology of, there's a lot of controversy about that, right? Like we're pushing people down into a way that they have to, stay under a certain number of hours to qualify for Medicaid. But if we're bringing it back to health and we're talking about addressing chronic disease and making America healthy again, a lot of these people that are on Medicaid don't have the resources to do many of these things. And the Medicaid is the only way to access doctors. And right now there is talk of cutting Medicaid.
They're not
How
going to
does
cut
that?
Medicaid. They're not going to cut Medicaid. That's not going to happen. You can have me back on and make fun of me in 2 months if they
No,
do,
no,
but
no.
No, no, no.
there's
That's
there's no
not
way
our
they're not going to cut
style.
Social Security, Medicare, or Medicaid. It's
But yeah,
But
I
they
mean
have
they're
proposed
staring it
lowering federal.
down.
Yeah,
Yeah.
they are. They're at least talking about it, and maybe
Oh,
they're not going to, and maybe it's
Do
just
you
posturing.
think do you think there's zero fraud in Medicaid? Or like what would you say is the percent you think there is? Because the people I interviewed for my book they all knew people who were scamming the system. This is why I say
Yeah,
they're not
look,
on
it's not about
Medicaid.
fraud. Of course, there's
No, so but so
abuse. Yeah,
if there's gonna be like I'm sure you have no problem with them addressing fraud, cutting when it comes to like fraud,
sure.
right? Like that's so we
But
would
I just
agree on
I don't think
that.
anybody thinks they're going to make up. I mean, look, Trump has very ambitious goals. He wants to put make permanent his tax cut. He wants to tackle the border. This invest more in the military. There's things that America elected him to do, and he is now looking for a way to have Congress offset the costs to do those things. My question to you is, do you think Trump really cares, and cares is probably the wrong word. He probably cares about America's health, obviously. I would think you'd think that. Does he put it as a priority? Does he want to put his shoulder into that when he has all these other things that he feels he has to do? Like, is MAGA behind MAHA? Because some of MAHA is going to be about more regulation on farmers, on big food industries. It's going to dictate what our kids eat in school. Those meals are going to be more nutritious, a la Michelle Obama's plan. Like, is MAGA really, as Trump as a leader of MAGA, are they really behind MAHA? I mean, where do you see that, or do you see tension, or do you see no tension?
I wouldn't say I've seen much tension. It's not a top priority for Trump. He cares about getting out of wars and he wants an amazing economy and a kind of like return to socially moderate policy. That those are the three things that sort of, if you think about the Republican Party under Reagan, and it had three main planks, right? It was socially conservative, it was very supportive of American exceptionalism, foreign interventions, right? And then it was free market. And Trump sort of took an axe to all three of those. He says, I'm not a conservative, I'm not pro-life. He believes in abortion up to 12 weeks. I'm pro-gay, supports gay marriage. He appointed Scott Bessent, the highest ranking out gay person in American history. You know, socially moderate, not socially conservative. He's not a free market person. He's a protectionist. So he wants massive tariffs and a closed border, limit the supply of labor. And then he doesn't believe in war. He doesn't believe that we belong in these interventions. So peace through strength, the kind of isolationism light, I call it, because it's not really isolationist. He has certain allies that he thinks bring a lot to the table for us that he's willing to do a lot for.
But the Maha is
So
Maha.
Maha's not, as you
Should they
notice,
trust MAGA or like
Maha's not in
Maha's not on
that,
that list,
is
right?
not on that list. I think I think RFK Jr. made him, an offer he couldn't refuse. I think he felt that would be great for the movement to have a diversity of voices, to have a liberal in the mix, somebody who brought a constituency with him of people who care about that stuff. But this is not a top priority, I would say. I think that Trump feels he's a bit of a trophy, like, look, I got myself a Kennedy, right? Like, he kind of like the way he had his trophies at the inauguration. Look, here are my, the Silicon Valley's on its knees to me, right? Like, he likes that. But I wouldn't say this is like a top priority. Of course, he wants Americans to be healthy, but like, he would not support, I cannot imagine him supporting RFK Jr. doing anything in terms of like vaccines. I think what Trump would support is like, more investigations or whatever whatever RFK Jr. is like, when he tries to
Studies
lie
don't
that he's
cost money.
anti-vax.
Yeah, right.
Like how he phrases
So
it.
wait,
Yeah.
that's a really interesting point, Batya, and I want to kind of press you on that because like right now the fear amongst a lot of folks in public health and a lot of folks who sort of believe in vaccines is that RFK Jr. is going to figure out a way to really erode trust in vaccines. And what do you say to that? Do you think when rubber meets the road, things aren't really going to change that much, or is this something that you're like he could try to do something here?
Or like in a weird way, is Trump the ally that public health actually needs right now to thwart RFK?
I think you're right about that. So on the left, because we all have many, many credentials, like, we really respect the views of experts. This is very absent from MAGA. There is not that same, people respect their lived experience. They respect their elders, they respect their community, they respect their kids, and kids respect their parents. Like, there's a very different relationship with information. In fact, people are actually ironically much better at critical thinking. Like, they're not going to just trust somebody because they're on TV saying it, especially when it comes to their health. And I'm an Orthodox Jew. I see this in my community as well. Like, the relationship that people have with expertise is very different on the right and on the left. And so RFK Jr. saying vaccines cause autism is not going to cause a gazillion working class people to not get the measles vaccine. Most people are very, very skeptical at this point of the COVID vaccine, especially because of the clause letting the companies out of liability. But they're not anti-vax. They draw a very sharp distinction between the COVID vaccines and the ways in which, especially the mandates, like all of the ickiness around them, and then just what their doctor is telling them their child needs and what everybody in their family got. So I don't think, obviously the crunchies are out there not vaccinating their kids for measles, right? We're seeing that right now. That's always going to be there. But I don't see that sort of, becoming some sort of like, snowball through the MAGA movement. Like, these are very commonsensical people. They're like Trump. Like, they don't like abortion bans and they have gay friends, even though they are conservatives and go to church and vote for Donald Trump. Like, they're much more like in the center than people imagine.
But if he uses his charisma to start reopening safety questions and things like that, it's human nature. You will be influenced if suddenly the messaging out there is, you know what, we're not so sure about the safety of vaccines. You know what, we're not so sure that you need the hepatitis B vaccine so early. We're not so sure of all of these things. It does start to erode trust. And he does it in an authoritarian kind of way. And and the argument is that it pushes people away because you've now lost that opportunity to engage with them if you've really broken that like circle of trust.
Well, let me follow up before you say anything, Batya, because there's some data showing that Republicans are growing increasingly more skeptical of vaccinations. That this was a party that, for the most part, about 24 years ago, was pretty supportive of vaccinations. It slowly started to erode. The pandemic happened, and it just came crashing down. And now only a quarter of Republicans believe that childhood vaccinations are extremely important. So we are seeing that there is this erosion in trust, and I guess it's interesting that you say that you don't think that will really ultimately amount to kind of a wide scale MAGA fueled anti-vax movement. But my question for you is like, there clearly is something happening to make Republicans mistrustful of vaccines in this country. What is a way to get at that community? And what is a way that either public health or media or whoever can approach a community that's becoming increasingly mistrustful of vaccines?
Well, the problem is that in many ways, over the course of the COVID pandemic, the medical community earned their distrust. That's how they see it, by telling them things that turned out not to be true and censoring alternative viewpoints and pushing, a very specific narrative. And then it would turn out that even when they were saying it, they didn't believe it. Of course, I'm sure you guys are all familiar with all the examples of this, but there's a lot of earned distrust of expertise. And the way that it was earned was by disrespecting the intelligence of average people. Like Mark, you said, well, just by his charisma, they would get convinced by that. I don't imagine you think you would be convinced by anybody's charisma on, certainly not a medical issue. Okay, you're in the field, but I imagine you don't think you'd be convinced by people's charisma in any area. And so it's like we
Oh, really?
treat
I think I
people.
would, right? We're
Really?
susceptible to that, right?
Give me an
You give me
I
example
would
of
say that's
of
how
something.
all cults work, and not to call it a cult, but like charismatic people draw you in, and it does not matter your background for you to end up in a cult. And it's that type of personality that can say things with such fervor that it's true. And if they've said things that align with you, it pulls you in. And by the time you're in, it's hard to get out, because then you'd be leaving your friends, your family. Like it becomes this.
Has that ever happened to you?
Yes.
Oh, we're learning.
Well, I've not been in a cult,
But
but there are strong personalities that we all interact with,
but
and
Batya, you're
we're
saying like
seeing.
this kind of stuff is the luxury of people with money and time and laptops. This is not the working class folks that of the heart and soul of MAGA. They don't have time to go online and research vaccine messaging, right? I mean, that is that your point that this
But they
is
are, it's weird because in a way, like it's been my experience that they are much better at critical thinking than people who are educated and
Hmm.
have like multiple degrees who have become very kind of submissive to credentialism. Like you see the list of credentials after someone's name. Oh, ipso facto, I must listen to what they're saying. They're probably right. They've probably done the work. Whereas working class people are like, no, they probably haven't done the work. They're probably trying to get something out of me. They're probably lying to me. And that would apply to RFK Jr. as well. I would say like the way if you want to appeal to these people, you just have to respect them. Like it's like the most obvious thing. Like if you want to convince somebody, hear them out. Like listen to what they're saying. The earned disrespect was earned. Like people forced people to die alone over not over a lie. They forced 2-year-olds to wear cloth masks. Like this is people. They forced disabled children to stay home so that their parents had to watch as these victories that they had worked so hard for, that the child can dress themselves and feed themselves and then go to school, they regressed and regressed and regressed and lost the ability to speak. Like, can you imagine what that's like? That person deserves an answer. Like, they deserve somebody to say, we fucked up and we're not going to do it again. And no one has done that. And I think that that is where the crisis in confidence comes from. All of the people who were in charge and in positions of authority just got away with it. It's one thing if you're wrong and then you say, I'm sorry, we were doing our best and we were wrong, but that didn't happen. And so now they think every time you talk, we're back there,
Right.
like I'm.
And what can that
Hmm.
look like, Batya? Like what can that public accountability that you think people are seeking look like?
It looks like, first of all, I think respecting a parent's right to be the authority over what happens with their child. Now, I obviously support vaccinations. I don't think, we have to have herd immunity to measles. Children will literally die, right? Okay, you don't want to give it there, give it somewhere else. Maybe the parent can be the authority on when their child finds out, about gay people. How about that? Like, there are a lot of things where people won't die if you can respect a parent's right to instead of saying, no, we are the experts, we know what's best for your child. You don't. Like, human civilization is built on the idea that a parent's love for their child is irreplaceable. I'm not talking about abuse, obviously, like there's limits, obviously. There are so many ways that you can convey to people, we respect you. We're not going to call you racist for opposing importing 20 million people to work in your industry. You know, like
I
there's
think
so
what's
many ways to do
happened,
it.
yeah, I think it's really interesting you said that about measles, because what's happening now, and we talked a little bit about this, Mark, you took us through the medical freedom movement, that it's now gone the other way. Like, it's swung so extreme in terms of the individual liberty to decide exactly what you want, that you're starting to see that erosion in, again, what used to be just routine immunizations for children, where it used to be that in order to go to a public school, you would need to get this many vaccines. And now that number is really coming down. And so I think it's really, like, you're right. I'm with you on those public accountability spaces. I think there need to be, we never really had a national reckoning with COVID. I think there's a lot of built up resentment. I would love to see what that could look like. There has to be some meeting halfway, that if every sort of collective action now goes away in favor of like the parental right to decide what's good for their kid, there will be a lot more sickness in our
No, I'm
society.
not saying everything. Like,
Right.
obviously, like there has to be, but the experts need to earn the trust of the American people back. And what I would ask you all to do is, I don't know if any of you are Christian. I imagine nobody here is a Christian, but just imagine
I
if,
am.
oh, okay.
And
I was
so
going to
is
use that as an
Tom and
example
Mark. Yeah.
and say, like, because I think this is a really good way to help liberals understand the horror people have of being told what to put in their child's bodies. It's like, imagine if, like, you found out that your kid was being told, to thank Jesus Christ, our Lord and Savior, every day before they had their lunch. Like, for most Democrats or liberals, like, that would be a very upsetting idea. Like, how dare you impose this alien thing on my child? This is not what I sent them here for. And, people feel like, let's just take a minute and imagine that feeling. Like, that's how they feel about this. Okay, they're wrong about this, and let's say the people who are against the measles vaccine, but we owe it to our fellow Americans to convince them of that fact. It's true. It'll be easy to convince them of that. And I do think, Tom, that Donald Trump will be an ally in this. If he starts to see measles spreading, he's going to really put down his foot on this. He is a very commonsensical person at the end of the day. He's not ideological at all.
I think that the whole point of our podcast is, why should I trust you, based on this breakdown of trust from, so
Yeah.
it's not a topic that it's foreign to us.
Right.
I mean, I think what we're trying to think about is, how do you move forward? And,
Mhm.
yes, like, we're not here to litigate whether or not there were failures in the public health response to the pandemic. I mean, that's the reason the five of us are here. I mean, it did expose weaknesses in our healthcare system. And I mean, whose fault is that, right? Leaders that, designed the system, yes. And there were problems with public health messaging. We've talked about that in some of our episodes. But I think it's really dangerous to label everything as, a complete failure. I really think if we're honest about moving forward, it's really, how do we learn from the challenges that we faced? You mentioned, we locked people up. Those were desperate times. I mean, this was a pandemic that rocked our world, and we need to improve communication and have better strength. And I think the question everybody's asking is, the likes of RFK, can Trump do this? I mean, that's where we really want to move forward. And I think that Evan Barker really hit it super well, because she is somebody who is raising her hand and saying, I have a chronic illness. And her chronic illness is nothing like anybody else is facing. I mean, quite frankly, the article that she wrote, she talks about a really rare, tragic genetic disease. And this idea that, make America healthy again by getting rid of pesticides and removing the red dye and no more seed oils, none of that is going to help her. She is looking for real, meaningful solutions that is going to help her genetic disease. And the only way that's going to happen is by intense research from experts who do have credentials. She has a genetic disease. It's not going away.
And also access to affordable healthcare coverage, which, Batya, I liked when I heard you say, in the end of the day, MAGA, this Congress, this president, as you see it, is not going to cut Medicaid. I mean, there's a ton of MAGA a ton of the MAGA community that lives on that line, even taking in effect the cliff you described, where people earn a little bit more, work a little bit more hours, and then suddenly lose access to Medicaid. There's still millions of of the MAGA community who depend on Medicaid. It's a popular program. The idea that MAHA is going to go along with cutting Medicaid, or MAGA is going to go along with cutting Medicaid, just seems absurd. It's going to send us, in terms of health, send us way backwards. So I was relieved when your analysis was that it's just not going to happen. They're going to find the money elsewhere. But my question to you is, as you've described it, Trump has a lot of big priorities. MAHA, a lot of them Democrats, voted for Trump. They took a leap of faith to trust Trump that he was going to forward their agenda.
Mm-hmm.
Were they wrong to trust? And if yes, let's just rip the Band-Aid off if you feel that. What is your message to them?
Man, Tom, that's like you're putting me on the spot there.
That's
I
right.
don't often get questions that I would rather not answer. No, I'm just kidding. It's a really good question. I think that they're gonna get, I think they will take the dye out of the food, I think that there will be like symbolic, it's patronage, right? It's a patronage system. Politics is patronage. So they're going to get something for their votes. Are they going to get everything? No. Is Trump going to be an anti-vax president? No. Is he going to allow RFK Jr. to like run rampant? No. Please God. I mean, that's my analysis. I hope I'm right. But I think that what they felt when they were welcomed into this movement was fellow travelers who are also fed up of being disrespected by the elites who have gotten made a big profit off of that disrespect. And I think that there's a lot of the people, if MAHA was their gateway into MAGA, they're finding that there are other MAGA values that they like. And honestly, like if they could find their way to God or find their way to another community, like that would be great too. Maybe the MAHA stuff would be, less pressing. So it's an interesting time. I don't know. I would say like that they threw their vote away, but I don't think, and I really hope they're not going to get everything they want.
Right. No, look, Batya, this has been such an interesting conversation because part of the reason why, we did this podcast, like per Mark's, what Mark was saying is like, it's just really great when we have someone who really kind of challenges our priors, our sort of way of thinking about things, but also taking this particular topic of the sort of compatibility of these two movements isn't something that, is taken on all that often. So I just want to thank you so much, Batya Ungar-Sargon. She's the author of Second Class, How the Elites Betrayed America's Working Men and Women. We want to thank her. I'm Brinda. He's Mark. He's Tom. She's Dr. Maggie Bartlett. And we would love for you to give us a rate, a like, a subscribe, a review. Send us questions at whyshouldItrustyou.net, and we will see you right back here next week.